The specific structures associated with fetal circulation include the placenta, the umbilical vein, the ductus venosus, the foramen ovale, the ductus arteriosus, and the umbilical arteries. Blood rich in oxygen and nutrients supplied by the placenta flows to the umbilical vein to the ductus venosus. Then, blood flows from the ductus venosus into the inferior vena cava up to the right atrium. This blood mixes with blood returning to the heart from the upper body by the superior vena cava and from the lower body via the inferior vena cava. Once in the right atrium, some of the blood flows to the right ventricle and some of the blood flows through the foramen ovale to the left atrium and into the left ventricle, where it is then pumped out into the aorta to the body. Blood that flows into the right ventricle is then pumped into the pulmonary artery. Because the lungs are fluid-filled instead of air-filled, the vessels in the lungs are narrow, creating higher resistance to blood flow into the lungs. Due to this high resistance to blood flow in the pulmonary circulation, blood pumped into the pulmonary artery by the right ventricle is more likely to flow into the ductus arteriosus and then into the aorta. Due to the high blood flow on the superior vena cava and in the inferior vena cava up to the right atrium, pressure in the right atrium are higher than in the left atrium. This promotes blood flow through the foramen ovale. Only 8% of right ventricular output flows into the lungs, providing nutrients for the developing lung tissues. Most of the blood passes through the ductus arteriosus into the aorta and out to the body. The umbilical arteries allow blood to flow from the fetal body and back to the placenta to be enriched with nutrients and oxygen. Once the baby is born and takes a breath, the umbilical cord is clamped and the placenta is removed from the systemic circulation. With elimination of the placenta from the circulation, systemic vesicular resistance begins to rise. With each breath, more alveoli in the lungs expands and the vessels surrounding them dilate in response to the presence of oxygen. In the postnatal circulation, blood no longer flows through the foramen ovale or the ductus arteriosus. The increase in left atrial pressure after birth forces this septum to close.